Welcome to today's webinar on practical solutions for accessing equipment and assistive devices. We are glad to have you join us. My name is Sarah Fuchs, and I'm a senior specialist with MDA's community education team. Today's learning event is a part of our larger MDA community education program, which focuses on bringing the neuromuscular disease community together around education and resources. Be sure to visit the community education section on mda.org for a complete list of our programs and educational materials. We are recording today's event and will be posting it to the website for on-demand viewing in just a few weeks. Everyone registered for today's session will receive a link to the recording via email once it's ready. Please know that all phone lines have been muted, but you can still ask questions. We'll have a Q&A session at the end of our speaker's presentation. For those of you joining us live, you can submit your questions at any time using the chat feature. Feel free to send them in as they come to mind, and we'll address them after the presentation. Please keep in mind that we may not be able to answer questions that are specific to your individual situation. For personalized guidance, we recommend reaching out to your healthcare provider who is most familiar with your needs. If you are looking for resources, the MDA Resource Center specialists would love to help. We will be sure to include information for the Resource Center in the chat, and we'll share additional information at the end of the presentation. Just a reminder that our goal today is to share information and resources in a supportive space. We appreciate your kindness and respectful participation in the chat. We'd like to thank the generous sponsors of today's program: Amgen, Edgewise Therapeutics, and Tanabe Pharma America. Their support helps make programs like these possible. For 75 years, MDA has led the way in funding research to accelerate the development of new treatments, expanding access to care and clinical trials through the MDA Care Center Network, and advocating for access and inclusion for the neuromuscular disease community. To learn more about MDA, including a complete listing of all of our programs, please visit mda.org. The purpose of today's program is to review the types of equipment and assistive devices commonly used by individuals living with neuromuscular disease, explain the process of obtaining durable medical equipment, and to discuss the roles of care center staff in obtaining equipment. The presentation will be followed by a brief Q&A with our speaker. Now it is my pleasure to introduce today's presenter, Molly Stark. Molly received her Bachelor of Science and Doctor of Physical Therapy degrees from the University of Wisconsin, La Crosse. She has been a physical therapist for 12 years, and she has 10 years of experience working with children and adults with neuromuscular disease. Molly is also a clinical evaluator and is involved in multiple clinical trials and research studies. Molly is passionate about enhancing therapeutic outcomes and quality of life for those living with neuromuscular disease. Molly, thank you so much for being here today. We're looking forward to your presentation, and I will now turn the time over to you.
So thank you for that introduction. Like she said, I'm Molly Stark. I'm a physical therapist at our center at the University of Minnesota. And I'm really happy today to talk to you about getting durable medical equipment and different assistive devices. I'm going to focus mostly on durable medical equipment, but I'll kind of vary a little bit and talk about different assistive technology and different setup for your home, and then keep coming back to the durable medical equipment. Just kind of as a disclaimer, I'm based in Minnesota in the United States, and all of my practice in physical therapy has been here. So that's the rules, that's the insurance that I'm used to dealing with. I will try to provide information nationally so that this is kind of a broad topic for everybody, but just know that that's where my experience is coming from. And then mostly I work in pediatrics, so that's also where a lot of my experience comes from. I do work with adults somewhat, and I've seen a lot of them for research, but a lot of the equipment that I've helped acquire for individuals has been for pediatrics. So today we're going to talk about a lot of different things as it relates to durable medical equipment. We're going to talk about the different types of equipment and assistive devices that are commonly used for individuals living with neuromuscular disease. We'll talk about the general process of obtaining durable medical equipment, or DME, as I'm going to probably call it going forward, just because it's a mouthful. We'll talk about the roles of care center staff in acquiring equipment, and we'll talk about different resources and key organizations that are going to be helpful as you're obtaining different DME. So first, we're just going to talk in general about equipment and assistive devices and kind of what's out there before we talk about the process of getting equipment for you. So durable medical equipment, as it's defined, is durable, meaning it can withstand repeated use over and over and last at least 3 years. A lot of insurance companies like to say 5 years as a general rule of thumb, depending on what the equipment is. And DME is for use at home, not just in a hospital or clinic, not just when providers are using it, but it's mainly designed for individual use. And DME is always ordered and prescribed by a licensed provider. So that might be your neurologist, it might be your primary care physician, but there's always someone involved in the ordering process who has a license to practice medicine. So, first, we're just going to talk about all the different types of equipment out there. And I can't talk about everything because everyone needs different things. You're probably in different stages of a disease process, have very different needs, but I'm going to just kind of talk broadly about what's out there in the different groupings of DME. And I apologize too, I had lots of pictures on my slides, and I realized as we were setting everything up, none of them carried through into the presentation. So you get one picture of a walker on here, but you can imagine different power chairs that I had on here. And I'll kind of describe some of the pictures I had that might be equipment you aren't as used to seeing. So when we're thinking about mobility aids, we're thinking about different equipment that can be used to make you as independent as possible in your daily life. Prescribing different equipment, trying to pick out the right equipment is really challenging because you might be at a different stage in your disease process. It really depends on what you need, how you're presenting now, and what your lifestyle is like. Are you leaving the home to go to work? Are you working from home? Are you not working? Are you a student? Do you have care all the time? Do you have no care? It really depends on what your lifestyle is like, depending on what kind of mobility aid might be helpful. I think of my role as someone's therapist as helping them predict when the right time might be to start using a device, because you're kind of going through your life, living day to day, figuring out how to compensate and be as independent as possible with what you have in the moment. But it's hard to think about like what 6 years from now, a year, 5 years from now might look like in terms of your disease process and what you might need. So I think that's the role of a therapist, is to really go, okay, here's where you're at now. What are we going to need in a year? And how can we start moving towards that so that you're ready for it when things inevitably change? And then once you get the equipment, then we talk about like how can you use it best to maintain your independence, and talk about, like I think it's a very hard conversation to start, especially when you transition from maybe using a walker or a cane to using a wheelchair more full time. I think it's hard to think about like when the right time is for that, and it is a big change in your life. I've noticed that a lot of patients that I've talked through this process, none of them, when they get their chair, say, "Oh, I wish I'd waited to get this." They all say, or they either say this was the right time, or they say, I wish I'd gotten it sooner, because it just helps conserve so much energy, helps them be more independent. A lot of times when they make that transition to whether it's a power assist or a power chair, they feel like they gain more independence rather than losing it, even though it's a little counterintuitive because it feels like you're becoming more dependent on a device. But really, it's helping you save your energy for the good stuff, what you really want to be doing, not taking steps throughout your home or in the community. So with that, there's so many different types of wheelchairs. There's power wheelchairs that are much more heavy. They weigh up to 400 or 500 pounds. Power assist chairs, which are kind of gaining some traction in the market in the neuromuscular disease community. Power assist chairs look like a manual chair, but they have some power in the wheels. And they can be driven in different ways, whether you're propelling them and then it uses your momentum and kind of keeps moving forward, or there's a new chair now called the M-Pulse M90, that's made by Quickie, and they can put this power system on any manual chair, and then you drive it with a joystick, or you drive it using the wheels if you have the ability to use your arms more. Um, so, anyways, I think we're kind of starting to see a shift in what technology is out there for mobility aids, because I think power chairs and manual chairs have gradually been changing over time, but this is kind of a newer shift. So then there are manual chairs. If you have the upper extremity strength to propel, you can get ultra lightweight ones, so you're not getting as fatigued propelling them. Or they're there for a caregiver to help push you around in the community if needed, and you have someone like that. Or there's scooters that are kind of a basic one size fits all, but can easily be put in the back of any vehicle. There's lots of different canes and walkers, four-wheeled walkers out there. And then it's important to consider like how you can set up your home to be independent with your mobility device, whether you need a ramp, if railings would be helpful for stairs, getting a wheelchair lift or a platform lift in your home if that's something that is possible, or a stair lift. But those are getting a little bit more outside of the realm of DME, but still something important to consider. And then in terms of seating within your home, there's lots of different seats. So there are riser or recliner chairs, and some of them like tilt you up as you go. Might work for some people. Oftentimes I've heard from adults with neuromuscular disease that because they tilt you up, it's really hard to lock your knees out if you have some weakness in your quads to get into standing. And instead, they almost make you want to like slide right out of the chair. So if that's a chair that you're considering getting, I would just encourage you to try it in the store and see how your transfers are out of it before you buy it. Oftentimes, too, chairs are just too low if you have weakness in your quads or in your butt. So it's hard to transfer out of them. So putting different riser blocks under them can be helpful, like throughout your home. There's also portable seat risers that kind of pop up. Same thing, they put you at kind of a funny angle as the recliner did. But if you're able to transfer out of it, they can be helpful. It's something I would try before you just get one. Bar stools are nice because they're very tall. Then there's lots of different wheelchair seating that could be its own topic in general. But just be aware there's so many different types of cushions for your chair, and you want to make sure you get one if you are able to transfer out on your own, that you can do that and it doesn't kind of like suck you in and kind of create a mold around your bottom where it's hard for you to get out of that hole. It's great for protecting your skin, but also we got to make sure you can transfer in and out of it. And then there's rolling or wheeled walkers. These are nice if you are pretty ambulatory, but if it is hard to get in and out of seats, oftentimes they don't make ones that have seats tall enough for you to get in and out of. So that's something to think about too. And then in terms of transfer devices, there's lots of different devices. A lot of times a Hoyer is what people who are not able to ambulate may use. That's something that is covered through insurance typically. Or a ceiling lift is something where the track is installed on your ceiling and then you use a similar sling to the Hoyer lift. And you choose, like the track will go from your bedroom to your bathroom to go back and forth there. If that's something you have, you also have to think about like if you are ambulatory and using that, or it's getting much harder, think about a way to get off of the floor if you do have a fall, or if you just transfer to other surfaces that aren't your toilet and your bed, like the couch or kitchen chairs. Sometimes the Hoyer is more portable and can help you recover if you do have a fall. Transfer sheets are helpful for individuals who are not able to sit very well and transfer. And then sliding boards are for those who are able to sit and have some good arm strength to scoot along, but aren't able to bear much weight through their legs. And then in terms of activities of daily living, there's lots of different equipment out there to help make things a little bit easier. These I won't get to in too much because it's a little bit more of an OT related item, an occupational therapist. They help with more of that activities of daily living. Um, if you are thinking that something like one of these items might be helpful for you, I would meet with an OT and try it. And especially if the OT has limited experience in neuromuscular disease, I would remind them that people with neuromuscular disease have a very specific way of doing things. That oftentimes this equipment is designed for more elderly individuals who may do things in a similar pattern than expected. But you, as someone with neuromuscular disease, might not get your shoes on the same way or might not do buttons in the same way. And so maybe that hook or the shoehorn might not be as helpful. For some people, it is, but I just have you try it with an OT before you start buying things that could help. And then in terms of bathroom equipment, excuse me, there's lots of different equipment that could be helpful. Um, In terms of showering, if you have the ability to have a roll-in shower, that's amazing, but not all of us might have that ability to change our home or to live in a place that has a roll-in shower. In that case, well, if you do have one, rolling shower commode chairs are wonderful because you can roll right into your shower, you can roll right over the toilet, roll into your bedroom to get changed, kind of do everything from one chair. If you don't have that, there are benches that can go over the tub if you have the ability to kind of scoot yourself along and you have enough arm strength. If you don't have that, but you still have a tub, there are these tilt tub slider systems where it has kind of like a rolling shower commode chair. This picture did come through, where that chair itself will detach from the frame and you can roll into your bedroom or over the toilet. And then it attaches to the frame and it scoots you right over the tub. So you just need somebody to help lift your legs up. And then you can tilt back in it so that you can wash your hair while you're in the chair. I've had patients using these a lot in the last few years and have really liked them. Um, let's see, there's also bathtub lifts. So if you're somebody who likes soaking in your bathtub and you have decent trunk control, bathtub lifts are a good solution. They are battery powered. You need to be able to scoot over onto it. So that's where the trunk control comes in and having some arm strength. But then it lowers up and down on a motor that's waterproof. Um, and let's see, the brand that I've had most patients using is called Bath Lift, but Lift is spelled with an I. Um, that one has been really nice and pretty reliable and is not super expensive if your insurance doesn't cover their bath equipment. We're going to talk a lot more about insurance and coverage of all these things. In general, bath equipment is something that insurance does not like to cover as often. There are still insurances that cover it. Medicaid covers it. Medicare sometimes covers it. But anyway, so looking for products that aren't quite as expensive but are still reliable is more helpful when it comes to bath equipment. And then if you are somebody who's able to transfer and take steps, making sure you have grab bars installed in safe places, I would have someone come into your home, either a contractor who works and does ADA accessible modifications, or have an OT come in so they can tell you the right place to put your grab bars. One, to make sure they're anchored really well into the wall, and two, to make sure that they are in a functional spot that will provide you the most assistance. And then, of course, having a handheld shower head is very helpful so you can get the water right to you and you don't have to reach way up. Someone else can help you, that you can rinse really well over your body and don't have to get yourself in the positions right in front of the water. Um, and then in terms of toileting, there are different lifts that can help you raise up into standing to get on and off the toilet. Um, there are just raised toilet seats in general or bedside commodes that can either go over your toilet or next to your bed. There are grab bars that you can install. Same thing, ask somebody exactly where to put them right by your toilet. Rolling shower commode chairs are helpful, both for showering and for toileting. And then having a urinal while you're out and about, if you are able to, is helpful. Okay, and then in terms of adaptive communication tools, I wanted to highlight a little bit what speech can help with. We'll talk about them a little bit more too. This is not necessarily durable medical equipment, it's more assistive and adaptive communication tools, but kind of falls under the assistive technology category. So if it is more difficult for you to speak verbally, there are speech generating devices out there, different tablet-based apps that a speech therapist can help you recommend. Have you tried different ones in clinic to see what could be helpful? Um, and then there's different access methods if you're not able to use a joystick on your chair. And maybe you use your joystick to control your computer, your on-screen keyboard, or your mouse. But even the joystick on your chair is getting more difficult. There's different ways using eye gaze tracking, using head or different switch activations. Maybe you have a little bit of movement in your elbow, but your fingers are harder. So let's see if we can get creative of where switches are for you to control things. Um, and then if you are kind of going down this road of more assistive technology itself, not the durable medical equipment, but technology that could be helpful, there are companies that specialize in providing technology recommendations. Um, So you can look within your state. We'll talk more about how to get to get connected to programs. But I know, like in Minnesota, we have technology for home, and they come out, they have a speech therapist, an OT, and a PT, depending on what kind of technology would be helpful to make you more independent in your home. They come provide recommendations and help facilitate everything through insurance if it's something that's covered by insurance. Technology gets a little bit more dicey if it's covered or not, but sometimes there's waiver programs that can help provide some of the payment for them. Okay, that's a lot of equipment. There's so much more out there. I just kind of want to cover the broad bases. Now we're going to talk about how to obtain it. Maybe you figure out, okay, I need this certain item. Now what's the next steps? Um, there's lots of different steps in obtaining DME. So the first thing starts with you is identifying, yep, I need something else to help me be more independent in whatever it is, getting around your home. Um, so that's something you should bring up with your healthcare team when you come in for your MDA clinic visits, or if you're with your primary care physician, bring up what you feel like you need. Even if you don't know what equipment it is, just say, I'm having trouble with X, and maybe they'll be able to kind of point you in the right direction. And then that provider also needs to put in a prescription or an order that can be from your neurologist, from your primary care physician, something that kind of initiates the process by saying, yep, this is indicated. They put on your name, they put your diagnosis, what type of equipment might be needed, and the medical reason that it's needed. And then you choose a supplier. A supplier is a durable medical equipment provider. You don't necessarily have to choose, but you are always free to choose which provider you want to work with. I would check with your insurance. Sometimes they'll have a website where you can go see which DME providers are covered, like within network in your insurance. And then you want to make sure that provider has the specific type of equipment that you need. Your therapist that you see can probably provide some recommendations if you just have no idea where to start. They can help make some recommendations. Or you might be locked in. If you live rurally, there might be one DME provider, and that's the one you go with. So it kind of depends on your needs and where you are. Then the next step is getting prior authorization. So this part you don't have to be involved in as much. Now you're kind of handing it off to the therapist and the DME provider. They are going to collect all the proper documentation and work with insurance and get kind of price estimates, and then ask the insurance pre-approve whatever equipment it is, or at least tell us how much they're willing to spend on that type of equipment. The review with insurance might take up to a month, depending on the insurer, and then they can come back and they can say, yes, fully approved. No, it's deferred, we need more information, or it's not denied for whatever reason. But let's say we're living in a perfect world right now, till we get to a few slides down the road. Let's say we're in a perfect world and they approve it. Then the next step is delivery and fitting. So then you're continuing to work with the DME provider. They order a custom selection of whatever, let's say it's a wheelchair you're getting. They customize it for you, they order it, the company builds it, and then the DME provider brings it to your home, makes sure everything fits, teaches you how to use it, customizes whatever last minute things they need to you, and then it's yours. Once it's delivered to you on the day of delivery is when it gets billed to your insurance. So the main time that becomes more important is, well, one, if you're switching insurance at any point, and two, at the end of the year. Like if you've already met your deductible, I know that the DME provider that I work with a lot, his December is always booked because he's trying to deliver every piece of equipment he can that has been approved and is sitting on his like warehouse storage, so that it gets billed through patient's insurance before the end of the year because they've already met their deductible and want their equipment billed within this calendar year. Um, and then you have it, and then you got to move on and think about maintaining it, and repairing it if necessary. So make sure you're keeping all of your receipts, warranty information, serial numbers, kind of everything about it. And then if there are any issues ever, you're reporting them back to your DME provider, and they're the ones who are going to help manage repairs. Most insurers replace equipment every 5 years or sooner if it's medically necessary. If something changes for you or something breaks that is not able to be fixed, then they would replace it sooner. Okay, so I've kind of hinted at all these different professionals that might help you in the process. Um, and some of these you may have experience with already. Occupational therapists really focus on daily activities, safety, and independence within your daily life. So they look at things more for the bathroom, things in your kitchen, making your home really smart so you can use different aspects of it with less physical interaction, and then might do bracing and stuff for your upper extremities. Physical therapists, we look more at movement, strength, balance, and your overall function. So, can you walk around within your home? Can you walk within your school or within your work? If you're not walking, how can we help you get around within those environments to navigate them successfully? So, we look more at mobility aids, walkers, wheelchairs, ways to stand and standing frames, that kind of thing. Speech and language pathologists focus more on communication tools, speech, language, swallowing. So they're helping with communication tools, different apps, eye gaze systems, equipment for safe eating and drinking. And then social workers are also incredibly helpful. They can help you navigate the system, help make sure that you have the right resources and social support to get the equipment that you need. They would be really good resources to help with home modifications and ramp installation, helping connect you with contractors, helping make sure you are connected through your county to get the right support if there is any, helping connect you with grant programs if you qualify, that kind of thing to help with the logistics of getting equipment and financing it. And then we already kind of talked about how to find different DME providers. I said, like, definitely ask the therapist you're working with because they might just have really good recommendations. Your insurance website, you can search for different providers, make sure they're in network. You can look up your state's assistive technology program through this website. You can Google the AT3 Center directory. This center kind of helps with programs for people with disabilities of all ages. They offer device demonstrations, short-term loans. They might help with financing. We'll kind of talk about them a little bit more too when we're talking about financial assistance. And then when you're choosing a provider, if you have the luxury of choosing between multiple providers, there are some providers that are more national, like you might have heard of National Seating and Mobility, New Motion. They have locations across the country. Or you might have a local one. Say you live rurally and you're the one who just has one option. That might be the one you need to work with. If you do have the option of larger ones that are national, you can think about, okay, am I going to college in a different state at some point and need to use a branch somewhere else? That might lend to using a more national one if you're able. And then sometimes bigger companies have contracts with more insurance companies. And so It's just kind of easier, broader to work with different insurance companies. But small companies can be really nice too. You might have one point of contact, one phone number you call every time when you have a question about a repair or a question about insurance. It's nice to just have one person to go through. Okay, insurance. When we talk about equipment, we got to talk about insurance too. Um, there's so many different plans. I can't talk about all of them, nor do I know all of them. But just broadly, Medicare Part B typically pays for up to 80% or about 80% of the approved amount after you hit your deductible. And then you would be responsible for about 20% coinsurance on whatever the equipment is. So you'll know from that prior authorization how much you would be responsible for if you get the piece of equipment. Um, if you have Medicare, you have to use a Medicare enrolled supplier and follow the rules where the device meets the medical necessity rules for you, meaning your doctor has to say this is a medically necessary device for this individual to function in their day-to-day life. And then some items, like wheelchairs, for example, need a face-to-face visit and a prior authorization. But your therapist helping you with the equipment will help you talk through what kind of things you need when you're ordering through Medicare. Same thing, they should also talk you through Medicaid and private insurance. They should kind of help you navigate it. And the DME provider will also help you navigate insurance with it. Um, for private insurance and Medicaid, each plan has its own list of covered equipment, different prior authorization rules, quantity of different things, limits. Um, Coverage with these might be a little bit more generous than with Medicare for children and people with certain diagnoses. Sometimes I'm speaking very broadly on it. But make sure you're checking if the supplier you're using is a network, if you need prior authorization for the equipment that you're requesting, and if there's replacement schedules, like can you get a new chair every 5 years with it. Um, when you are working with insurance and getting a new piece, make sure you're asking for a written estimate, especially if you're going to have a copay, you want to know and have it in writing what your copay is going to be. Um, and then, excuse me, make sure when you have an appointment with the therapist and the DME provider that you bring your insurance card, and if you have your prescription from your provider when you're talking to them. That just helps kind of speed things up and they can start the prior authorization process. They can't start it without those items. Okay, and then so we're to the point where we're in a dream world again. You got your equipment, and you need to help maintain it. So, kind of some kind of key tips for that are making sure you keep all of your paperwork together. So, your prescriptions, invoices, warranties, who to contact if something breaks, your serial numbers. One other thing I would keep together, this is not repairs related, but just made remind me if you do have a power chair and on delivery, the person delivering it should know the weight of it. It should be somewhere in your paperwork. Write that down in case your clinic has a scale that you can drive onto with your wheelchair. Um, then you'll know it. A lot of times, my patients, we just put a sticker on the back of their chair that says wheelchair weight, 435 pounds. So when they drive on the scale, we can subtract that. Okay, side tangent. Um, let's see. So in terms of repairs, make sure you know who to call if something does go wrong. Usually the company you work with will have a different number if they're not a super tiny company, but if they're a little bigger, they will have a number to call that is their tech support that you can talk about what's broken or what you think needs to be changed on your device. Um, and then if something is broken, you feel like, no, it's making me unsafe to use it, your therapist might be a good resource for that too, so they can kind of help talk you through it. But I would really start with your DME company. They're going to be the ones who really know what's broken and how it's going to affect the function of the device. Um, Ask questions about your warranty and your service plans. Ask how long is repairs covered on this? What is covered? Is there a service plan for it? Some warranties will cover labor on things, but not parts or vice versa. So just make sure you kind of know what's covered. Sometimes too, things are billed after the fact. So you pay for the wheelchair itself through insurance, but then down the road, you need to replace the joystick. That would be potentially separate and they would bill again through insurance. Versus like maybe within the warranty, it replaces batteries in your chair every 1 year or every 18 months or something. So that might not be a separate bill. So just kind of ask what's covered under the warranty. And then have a plan for emergencies. If something breaks, make sure you know who to call and if there's a way you can get a replacement device during that time that they are fixing it, so you can get around or sleep or whatever it is that they are fixing during that time. Um, and then learn about simple ways of troubleshooting, ways you charge the battery, checking different cables, maybe something's unplugged. Say you have a power chair and it can be slipped into like a manual mode so that someone can push you if you are like next to a pool or something. You don't want to drive next to a pool with your power on, but if someone can push you, the chair has the ability to switch into a manual mode. Make sure you know how to switch it back and forth so you don't just get stuck in manual mode. And then make sure that you're doing routine safety checks or bringing it in for checks, looking for loose screws, different straps that are frayed, worn out tips on your canes or your crutches. If your wheelchair tires run out of tread, as they do over time, I know like every fall I'll look at my patients' wheelchair tires because if they run out of tread and we get, as we already have a foot of snow here, you can't really drive in snow if your tires have no tread on them. Um, so anyways, checking for that too. And then making sure you're cleaning the equipment to prevent skin breakdown and infections. Okay, so now I talk about it might not be a perfect world. There are barriers when you're getting any kind of equipment. One, of course, is the expense. There's a lot of out-of-pocket expenses. There's high deductibles, co-pays. Items might not be covered completely or might be partially covered. Um, and then in terms of insurance, there can be denials or delays. Maybe they're missing paperwork. I had one last 2 weeks ago that I didn't explicitly say I was a healthcare professional trained in doing wheelchair evaluations, even though I had a 10-page document explaining everything we needed out of the wheelchair, everything I'd done with the participant. It showed I knew what I was talking about, but I didn't explicitly say I am trained in this as a healthcare professional. And so they're looking for specific words in their policy to match what's in letters. So all I had to do was submit something that said, I am trained in this. And then they approved it right after that. But that can slow things down, based on every policy. And because I don't know every policy, I don't know what their language is that they're looking for. So if you get a denial, making sure you're asking for exactly why, and then you can help loop in the therapist who might not get notified as quickly as you, what else you need from them. Okay, other barriers are limited access to suppliers. Like I talked about, if you live rurally, that might be really challenging. Sometimes they have to drive a few hours to come out to your home to make repairs, and so that can take some time to get them out to your house. Supply and shipping issues. We saw this a lot post-COVID when there was a lot of shipping issues. We weren't getting parts for replacement for chairs for like 6 to 9 months, and so that was very challenging to not be able to fix what was broken on chairs. And then different information and communication barriers. You are dealing with lots of different people, your therapist, your doctor, the DME provider, and it's hard to know who's responsible for what delay or who are we waiting on to get something submitted. So that can be challenging, and just asking as many questions as you can is kind of the way to get to the bottom of it. And then there's physical and transportation barriers. Getting to the clinic, if you don't have accessible transport, is challenging, and a lot of times they need a face-to-face visit with you. So I know that can be very hard too. So then we're going to try to talk about a few different ways to manage some of those barriers with different resources for obtaining DME. So there are equipment items that are just not covered because for multiple different reasons. They might be considered a convenience or a comfort item, like an extra wide recliner, different lift chairs, air purifiers. Those aren't considered medically necessary, so those would be denied right out. Um, they might not have a primary medical use or might not be used in the home. That would make something denied most likely. Or they might not meet the durability or lifespan rules. So it'd be something that's more of a few time uses and then it's not able to be used more. That doesn't meet the DME criteria and might not be covered. And then if you have insurance, like we talked about Medicare, having a list of things that it covers, it might not be on that list of things that are covered. So what do you do when something's not covered? First, ask for a written copy of the denial letter. It explains the reasons that it is not approved and how to do an appeal. And then loop in your therapist and your doctor and see if they can write a letter that addresses the reasons it was denied, and talk about specific goals within it. And then you'll file an appeal. This can be done in conjunction with your clinic. It's not all on you. That's why you're part of a team. Um, Sometimes you need to initiate it, but then the clinic can help give you the paperwork that you need. So follow their deadlines. Some of them are quick turnarounds, like that one I told you that I had to state. I was trained in wheelchair evaluations as a healthcare professional. They said you have 10 business days. And if we hadn't sent it in those 10 business days, we would have had to start the process all over again from the beginning. So paying attention to dates and getting things done as quickly as possible is important. Um, and then ask about alternative options. Sometimes there are different models or different levels of devices that may be approved that you just have to switch from one to another one. And then if an item is still not covered, then let's start to think creatively about loan closets, community reuse programs that might have short-term or used equipment rentals, nonprofits and charities. The state assistive technology programs offer some loans, low-cost loans, or refurbished devices that might be helpful. And then disease-specific foundations might offer different grants that you could be eligible for. So let's talk about that a little bit more. The financial assistance resources, the state assistive technology programs, they're available in every state and every territory. These offer device demonstrations, so you can try something before you buy it. They offer the short-term device loans. They offer different reuse or refurbish programs, and they have state financing or loan programs. So this is that AT3 program that you can look up in your state, and you'll have contact information on the website. I had it linked in kind of one of the earlier slides, so you can look that up when these slides are posted. And then looking for alternative financing and loan programs. There are some listed on this website. The National Disability Institute has different affordable loans for assistive technology and home modifications that you can look into. And then as far as loan programs, there are nonprofit assistance and loan closets. There's lots of local charities, senior centers, churches, disability organizations that you might have locally. This is where I would ask your social worker or case manager or potentially therapist what's available in your area, because they would know those programs best. And then there are national level resources that have charities that provide grants for equipment for people with disabilities. You can look up some of these organizations. A lot of them are like reuse programs where they accept donated equipment and they refurbish it and can give it out to those who cannot afford it or who meet their qualifications. Some of them, like the Convalescent Aid Society, I think that's more of an East Coast one, but covers multiple states. The Hero Fargo one, that's healthcare equipment recycling organization that's across the U.S. They match donors and charities with that can help with different medical equipment and anywhere from like hospital beds to wheelchairs. And then other tips, for sure, connect with your social worker or case manager. Keep a folder with information, insurance details about what you qualify for. Keep a diagnosis or information about your diagnosis because they might ask for that if you're applying for a different grant or going through a program. They'll want some kind of basic information about what you need. And then have a brief letter explaining about how it will help you improve your safety and independence so they can really understand why it's something that is medically necessary for you. Okay, and then the last, but one of the very important things I want to bring up too is how MDA can support you when you're when you are needing equipment. So MDA has a durable medical equipment grant program. They provide grants for essential DME like wheelchairs and lifts. They have an application portal and a step-by-step frequently asked question on eligibility, documentation, and how you can apply all on their website. They also have an on-demand workshop that covers access to coverage, equipment, and assistive devices that can be helpful on their website. They have different guides and toolkits that you can use. So they have one on navigating equipment and assistive technology. They have one on DME toolkit, kind of talks about different device details, vendors, warranties, that kind of stuff. They have a community resources toolkit. Excuse me. And then they have a health insurance worksheet that helps you track your benefits, costs, different contacts, people you've talked to, that kind of stuff to kind of help keep everything organized because it's a lot to keep organized. They also have a Quest magazine if you are not receiving that already. Oftentimes they have articles about product comparisons, funding, different pointers for funding, how to start getting mobility aids or home lifts, useful handouts for patients and caregivers, and then examples and tips for finding different equipment. And then the last thing is the Resource Center that was mentioned in the beginning. This can provide one-on-one help to connect families to local suppliers, funding options, and reuse or loan programs. Okay, so just some kind of key takeaways because we've covered a lot today. One of the biggest things is ask early. Like if you think you're starting to need something or things are changing for you, inquire with your team right away so you can start getting the necessary equipment to help support you. Sometimes the process can take months. I've had wheelchairs take over a year, so it can definitely take a long time. So starting early is important. Keep a DME folder with all of that information that we've talked about, your prescriptions, evaluation reports, warranty, everything like that. Know who your allies are. So your providers in your MDA care center, your OT, PT, speech therapists, social workers, they all have different roles, but they all have the same goal. That's getting you the right equipment at the right time to be used safely to help you be as independent as possible. And then make sure you know different state and community resources. Like every state is different, but there's a lot of times waivers and stuff through your state. So making sure you know those resources and you have a local contact to help you with that. And then if you are ever in doubt about something, ask your providers. You know, if something breaks, doesn't feel right, feels unsafe, call your therapist and provider, call your DME supplier right away. So that you make sure you're getting something taken care of as soon as possible. Okay, so with that, I'm going to end. So we have some time for questions and I kind of go through things. Like Sarah said, I can't answer really specific questions. I want to make sure the information is helpful for everyone, brought as broadly as we can. But I will stop there and take some questions. So thank you.
Thank you so much, Molly. That was full of some great information, and I love the resources at the end. That was very helpful. Thank you.
Yeah.
I'm just going to share my screen here.
Good.
We had lots of questions come into the chat, so we're going to get started here. For kids who are transitioning to being non-ambulatory, is it advisable to use a rollator or walker as a measure to still support ambulation, or is it safer to switch to a wheelchair at that stage with frequent falls?
It's a really good question. So anytime I'm talking about assist, I talk about, or an assistive device, I talk about what's going to be the most functional for you and what's going to be the safest. So if it is functional for them to walk around with a walker and they feel really safe with it, great, use it. It feels good to be on your feet. It's important to be on your feet and move around. But like they mentioned, if they're having frequent falls and it's exhausting to get from point A to point B using a rollator or a walker, I would encourage them to start using a chair sooner rather than later. Like I said, it helps conserve energy so that they can maybe stand and transfer more easily throughout the day, and not use all of their energy on just taking steps.
Great advice. Thank you. Um, so moving on to some more general questions. Are there websites to look at these devices visually to see how they work? We live in a small town and would have to travel to see most of these items in person.
That's a really good question. Um, and I don't know the answer to it. I know that like specific equipment companies make nice websites to show, like Quickie, for example, they make wheelchairs. They have really good demos of their chairs on their website, but you have to know you're looking at a Quickie chair. So sometimes it might be helpful to start with the evaluation with the therapist and the DME provider. They can start pointing you in the right direction and might give you a few things to look into so that you're not just Googling this broad array of wheelchairs or hospital beds or whatever you're looking at.
That makes sense. Thank you. Um, Somebody wanted to know, how does someone qualify for Medicare Part B?
Ooh, I am not a good person to answer that because I work in peds. So I don't really have patients on Medicare Part B. I would start with your social worker and your primary care provider, and they can kind of help guide you through it.
Great, thank you. Um, we'll move down to accessible vehicles, questions about that. I'm about to be fitted for a wheelchair. I am worried about how to transport it. I travel a lot. How does that work without getting a whole new vehicle?
Depends on what you have now. So there are different companies where you can bring your vehicle in and they can talk about what, if your vehicle qualifies for modifications and what they can put into it. So let's say you have a van or an SUV now, they can tell you if they can put a front or a side entry one in, if they can put hand controls in it. Um, those providers are going to be the best. There are also occupational therapists out there that are qualified to do evals to tell you kind of what safe ways are to drive. So I would ask your neurologist to kind of give you a list of if there are OTs in your area that help do those assessments. But if you're really just inquiring about your vehicle and if how it can be modified without buying an entire new one, I would go to the companies that make the modifications and they can kind of give you information on your specific vehicle.
Absolutely. And I just would add to that, if you wanted to contact the MDA Resource Center, they might be able to give you a jumping off point for where to start with that or what to look into. So that might just be a quick call you can make that might help.
Yeah, great idea.
Um, do you have information on how to acquire an accessible vehicle?
Yeah, so depending on if you have any like state funded insurance, like if you have a Medicaid or if you have Medicare, they do contribute. Well, I shouldn't say Medicare necessarily, because like I said, I don't work with it. I know Medicaid. If you have Medicaid, you qualify for some funds to help modify a vehicle. Um, so then I would start with if you have like a case manager through you for Medicaid, like through your county. If you just have private insurance, then I would use like a social worker through your hospital or clinic system to help you navigate it. Um, and then they will kind of talk about if there's any funding options out there, if you qualify for any grants. And then once you kind of figure out where the funding is going to come from, then I would go to the suppliers that make wheelchair accessible vans or SUVs and talk to them about the different options once you know how you're going to pay for the modification. Um, you can either modify your existing vehicle or get one that's already modified or get a new vehicle and then modify it. So there's lots of different routes you can go. That's why having a social worker help you navigate that is really helpful.
Yep, it can definitely be a process, but taking
Yeah.
it step by step is important
Yeah.
and having a support system in that.
Yes, for sure.
Um, so we also had a lot of questions about like equipment specific questions. Is a high-low articulating bed considered DME?
A high-low articulating bed. Yes, it's considered DME because it's durable. It's expected to last at least 5 years, and you use it within your home. Um, and you need a prescription from a provider in order to get it. So to do that, I would bring it up with your provider. They can put in the prescription, and then you can start working with the DME company to get the bed that you need.
Perfect, thank you. Um, Is there adaptive equipment for using a keyboard and mouse?
This is where I'd have you ask an OT or speech therapist who's specialized in assistive technology. There are on-screen keyboards and mouses that you can use, and you can connect like through. If you have a power chair, you can use your joystick to do that. But that gets more into the technology realm that I don't do as much of. So I would find an assistive technology company that can help you with that.
Great, thank you for that referral. Um, I have weakness in my arms and core. Would a slide board work for transfers?
Most likely not. It depends on how much weakness you have. If you can sit unsupported and you can use your arms to bear a little bit of weight through, you might be able to. But if you need any kind of support for your trunk, like you're not able to sit independently, or if it's really hard for you to stabilize with your arms or push against something, a sliding board most likely wouldn't work for you, um, unless you have someone else there to help you and who can be really close to you and they can kind of help scoot you along it. Then it might be helpful.
That makes sense. Thank you.
Mhm.
Um, just to respect everyone's time, I'll take two more questions here, and they're both equipment specific. Seat cushions are an issue when sitting on the chair for a long time. What kind of cushion would help with pressure on the tailbone?
There's a lot of different cushions out there. And the DME provider is going to have a bunch that you can try, and they can put them on what your sitting surface is. Sometimes they can loan them out to you for a week. So I would start with them. A lot of times, too, if you go to a seating clinic, they will do some pressure mapping to show exactly where you put pressure on your tailbone or leaning forward. And then they'll put that pressure mapping over a few different cushions that you try, and they can tell where you are or which kind of cushion you use to distribute your pressure really well. So I would go to a seating clinic and an OT who do that and have the DME provider bring a few cushions if that's possible.
Great idea. Thank you. And then for our last question, is an electric bidet lift covered by insurance? Are there any grants or funding available to cover this?
Typically, I don't think it's covered by insurance, like a private insurance or Medicare, but it might be covered under a waiver program if you're somebody who has a waiver through your state or your county. Sometimes they will cover equipment like that. As far as coverage for them, if you don't have a waiver like that, I'm not sure. I would check out one of those when the slides are posted, those companies that help connect you with medical equipment. Um, I would check out them and see if they have a process for helping you, like give some funding for that.
It's a great idea. And then again, I want to plug the MDA Resource Center. They have a huge database of plenty of resources, both national and local. But with that, I want to wrap up our Q&A session. Thank you so much, Molly, for being here today, sharing resources, and taking the time to answer our questions.
You're welcome. Thanks for having me. It's been a pleasure.
Thank you. And now for everyone else in the audience, if you could just hang in with me for a moment, I want to tell you a little bit more about MDA's programs and give you some contact numbers for the MDA Resource Center. But before we conclude, I would like to thank our supporters, Amgen, Edgewise Therapeutics, and Tanabe Pharma America. Oops. This year marks MDA's 75th anniversary. We remain committed to honoring this legacy by building on the impact we've made together and continuing our momentum toward transformative progress for people living with neuromuscular disorders. To learn more, visit mda75.org. MDA's Equipment Assistance Program provides support for individuals and families who need help obtaining essential mobility or medical equipment, helping promote safety, independence, and participation in daily life. Through this program, eligible individuals can receive assistance with items such as wheelchairs, lifts, and other durable medical equipment that may not be fully covered by insurance. The goal is to reduce financial barriers and ensure people living with neuromuscular disease have access to the tools they need to live more independently. Please click on the link in the chat or contact the MDA Resource Center for more information. MDA offers several programs for the neuromuscular community, including community support groups, summer camp, youth mentorship, and more. We again invite you to join the MDA community. Joining is free and will help you stay up to date on our programs as well as the latest research. Please scan the QR code with your smartphone or visit the link in the chat. We'd love your feedback. Let us know what worked in today's program and what can we improve for next time. Please take a moment to complete the short survey that will appear right after this webinar. Your input helps make our future programs even better. If you have any questions or are looking for support or resources, please contact MDA's Resource Center at 1-833-275-6321 or via email at resourcecenter@mdausa.org. This concludes today's webinar. Thank you all for joining us. Have a wonderful holiday season, and we hope to see you again soon.